Good afternoon from Washington, D.C. I'm former Congressman Mike Ferguson. I'm the leader of BakerHostetler's federal policy team. Welcome back to the third installment of our bipartisan webinar series, BakerHostetler Bringing Congress to You. We're now in our fourth full week of this new reality. Congress is working toward a fourth bill providing relief for struggling Americans across the country. We here at BakerHostetler are very pleased to continue our bipartisan series. Today we have a House member who's on the front lines of the COVID-19 battle with thousands of his constituents in northern New Jersey who've been affected by this crisis. We will be joined in just a moment by our guest, Democratic Congressman Josh Gottheimer. You can submit your questions, any of the questions that you'd like us to ask him. Please submit your questions on your control panel to the right of your screen on this webinar. If there are some questions, there are always questions that we're not able to get to during the webinar, and we would be happy to follow up with you afterwards to try and get you answers to your questions, any questions that are submitted. Let me also give a heads up that our next bipartisan webinar will be next Tuesday, April 14th. It'll be at 12 noon. And we'll be joined by Republican Senator Thom Tillis from North Carolina. We actually have two webinars next week. The first one will be on Tuesday with Senator Thom Tillis. The next one will be on Thursday, the 16th, with Senator Chris Van Hollen from Maryland. So speaking of North Carolina, before we're joined today by Congressman Gottheimer, let me again introduce my partner in these bipartisan webinars, my colleague at BakerHostetler. He's a fellow senior advisor here at the firm and former Democratic congressman from North Carolina, Heath Shuler.
Hey, thanks, Mike. Glad to be back with you and another excellent guest today. Our BakerHostetler federal team and our clients have been deeply involved in this fast-moving policy-making process responding to the pandemic. This is an incredible series, and I just incredible insight that we're getting, and I'm glad that we're able to hear directly from the policymakers.
Yeah, especially now when we're in this time of uncertainty, things are happening fast. It's important for businesses to be on the leading edge of that information as it's coming out. We obviously saw some announcements this morning, both from the Fed and from Capitol Hill, with continued negotiations on these the next piece of legislation. So we're trying to stay on top of that and helping our friends and clients from around the country stay on top of that as well. So in case you're just joining us, welcome to another in our bipartisan webinar series, BakerHostetler Bringing Congress to You. I'm former Congressman Mike Ferguson. I'm the leader of our federal policy team here, and I'm here with my colleague at the firm, former Democratic Congressman Heath Shuler from North Carolina. And we are awaiting any moment. Our guest will be joining us.
I'm on.
Congressman
It's Josh.
Josh, I'm delighted that you're here. We're delighted to
How are you,
be able
Congressman?
to welcome you. I'm doing great. It's great to hear your voice. Heath, Josh Gottheimer's been on the front lines of this crisis since the beginning.
Yes, absolutely, Mike. It looks like, if you look, there's tens of thousands of confirmed cases across the state of New Jersey, and obviously the northern area, which was a neighbor of your district. The congressman has he was one of a dozen members in the House that self-quarantined after potential exposure.
Yeah, and thankfully he tested negative. He's as you can hear, he's healthy. He's continuing his work, helping folks in northern New Jersey. It's a scary time, Josh, for so many of them and for millions of people around the tri-state area. Obviously, as a New Jersey native myself, I'm staying connected to so many of my family and friends back home in New Jersey, and I know some of the most meaningful work that we all as elected representatives, former elected representatives, had the chance to do is serving our constituents whatever they might need, particularly in a crisis like this. In normal circumstances, Congressman Gottheimer is a member of the Financial Services Committee. He's really emphasized bipartisanship throughout his tenure, especially as the founder and co-chair of the Problem Solvers Caucus. He's led the effort there to empower this group of 25 Democrats and 25 Republicans and its ability to influence legislation in a pragmatic direction, particularly on taxes and reducing unnecessary regulations and building our country's infrastructure. So I'm very pleased to introduce my proud fellow New Jersey native, Congressman Josh Gottheimer. Josh, thanks for being on with me and with Heath Shuler today. First of all, glad to hear that you are healthy and working hard. Tell us just a little bit first about how things are going in New Jersey. We know from the news, we've got people across the country on this call, and on this webinar, but we know that New Jersey's really at the center of things right now. How are you doing? How is your family, and how are your constituents in your district, and how is Governor Murphy doing, and how is New Jersey handling all of this?
Thank you so much, and I really can't thank you both enough for doing this. It's really important that we come together and talk to one another and work together. And I think you've seen the great product so far of a country that's putting America before the partisanship and especially over these last years, the idea that we've got to rally together, and we're really seeing the effects in New Jersey quite a bit, and of the virus, but also of the response and of just how people come together. And I'm grateful, and I hope you and your family and everyone's family and friends are doing well right now and staying healthy and safe. Just a couple things about New Jersey, which I'm sure you followed, and the governor's really done an excellent job leading here. We've got over 47,000 cases in the state of New Jersey. And in my district, about a little over 11,000 cases. We've had more than 400 deaths in my district, which is in northern New Jersey, right outside New York City. So a lot of people in and out of New York, of course, day to day, and we've seen the devastating impact it's had on New York. So it's been a huge health hit and a pandemic to the area. In my district is a town called Teaneck. And where it was one of the first hospitals that was really hit hardest is there, and Hackensack and Hospital and Holy Name Hospital and many of the hospitals and Valley Hospital, all these in the cluster that took an early, really trying to adjust early, both getting protective equipment, which, as you know, there's been shortages of. We're doing better now than we were a couple weeks ago, much better. Shortages nearly daily that we've had to deal with on ventilators, which, as you know, has been a problem around the country. Thankfully, everyone's rallied together on that, both from the stockpile and, of course, other states have helped. So that's been good, and the economic side has been very tough. We've been social distancing and self-quarantining for weeks, even before a lot of other places in the country have. And so that's been devastating to the local economy, very hard on our residents, but who are doing an excellent job, both teaching and, education at home and homeschooling, and all of us trying to figure out how to do long division again. But really, the impact on our community in terms of our businesses of all sizes has been, like everywhere in the country, it's been very difficult on jobs and the businesses themselves. So I'd say that I believe the legislation we passed together in a bipartisan way, which, as you know, has covered everything from direct resources to people and dollars to people to help pay their rent and get food on the table, to and pay mortgages, to obviously the small relief for small businesses and PPP program, which is getting up and running. And I'm sure you both know, as members of Congress, not easy to get the government. Government is not normally a rapid response operation or building a new program, but I think the banks and the SBA are doing their best to keep up with guidance from the Fed and handle that. But I think the supply right now, and the demand is outstripping supply, which is why we're trying to get this extension done. But there's other issues for the state. These states need more resources, which we're trying to get more for. Our hospitals need more resources. So there's been a lot of demand there, especially in the states that have been hardest hit, like ours. And last, I'd say that you've got food security issues, so making sure that our seniors are taken care of and our kids are taken care of on school lunch. And so those programs are there, but we need to, the whole system has got a lot of strain on it right now. And I really want to hand it to everyone for stepping up, and especially our frontline healthcare workers and first responders. But it's tough. And we're worried. We saw a big outbreak in the last days, more so in our long-term care facilities and our nursing homes. Big issue in a veterans home in Paramus, New Jersey, where there's been a spike in cases because it started spreading, and that's been a huge issue that many of us are concerned about. So you've got a lot of issues, and we know this is going to be affecting other communities. So the CARES Act And the other two packages before were great pieces of legislation in terms of helping respond. They're not perfect, but I think they've got a lot that's really going to help. I think we're going to need more, especially as we focus on the getting back to business side of this, which is that last piece, right? You're dealing with the immediate crisis, health and economic, and then we have to, in this next package, see what else we need to do in terms of the immediate crisis, but also thinking about whether it's serological testing or getting more expanded testing out on every front, making sure that our hospitals have what they need, which is essential. And I'm concerned about that. And our PPE and our frontline healthcare workers and our first responders having what they need. God forbid there's another outbreak, or to deal with something in the fall, or if we send people back to work, and if and there could be other flare-ups, making sure we're prepared for that. And then of course long-term stimulus and long-term ensuring we have the supplies we need. So we'll have potential infrastructure. Some of us are pushing for salt changes, and then there's other just stockpile issues that we're going to have to really address until we find a vaccine that is going to have a big impact on society, as you know. So we have to be prepared for all those pieces, and we're trying to adjust for that.
Well, you've got a lot on your plate, and I know my friend Heath has a question he wants to talk to you about, but I just want to thank you so much for everything you're doing in New Jersey, and certainly hits home for some of us who know the area and know those communities so well.
Thanks, man. I really appreciate that.
Josh, hi, this is Heath. I just want to thank you for being a part of a bipartisan group in Congress. And I know how difficult that can be. Certainly, an election year, how divided Congress has been over the years. And first of all, being very pragmatic about your approach in legislation. And so hats off to you. And that
Thanks,
to me is members like yourself and the other 49 that are a part of that group can really be difference makers going forward. Certainly in the crisis situations that we're
literally we just got off. Yeah, we just literally got off a call right before this call with our group. And we've been meeting a couple times a week on Zoom, and we've had either bringing experts in to help us prepare. We're working on what should be in the next package right now as a group to get behind, and we've been pushing on. We really had a lot to do with that first package, and we giving our opinion and working with the White House and with also the House, Senate, and the House. So that's really unbelievable. It's how we should do it every day. But as you know better than anybody, that's easier said than done these days.
It's hard. Yeah, and speaking of that, and obviously, I'm not asking you to kind of give confidentiality information between your group, but what are the next steps? I mean, is there a 3.5 phase? Is there a phase 4, phase 6? I mean, then you got the infrastructure on that. I mean, with so much is needed in from the hospitals' needs, the doctors' needs, and then the small businesses, and what does that next step look like, or what does the next phase look like going forward?
It's a great question. And Tom Reed and I, who's the Republican co-chair of the Problem Solvers Caucus, started outlining, based on our conversations with the caucus. We had a piece a few days ago in USA Today, an op-ed, of laying out what we think some of the benchmarks are that we're going to have to hit. And we need a plan here, because you need to publicly, I think, release benchmarks so people know what they're shooting for here. I think the uncertainty is very difficult for folks, right? When are we going to open up? We don't all know the answer of when the curve's going to bend and flatten out. In every community, we're seeing glimmers of hope here in New Jersey, and I know New York is too. But we have to lay out those benchmarks. And what we've thought about so far is, one, having widespread and rapid, obviously virus testing, but also serological testing on the antibodies. I think that's going to be essential, right? Who's able to go back to work? Even though there's a lot of question marks about the antibodies and how long they'll last for. In the meantime, we need to figure that out and have these benchmarks out there. But you need the tests, right? Otherwise, it's impossible. And we've ramped up significantly on the tests, but frankly, not enough and not fast enough yet. But it's happening. I was just on the phone with Beck Dickinson, who's in my district, that's worked out tests, and they've gotten out there. They're just saying it's a lot to get out there. So 1 and 2, I think you need to, as I alluded to a few minutes ago, be prepared. Our hospitals and our frontline healthcare workers are prepared, have the protective equipment. Our first responders do as well, so that they don't keep getting sick and sidelined themselves. And that we've got the equipment in the hospitals if we were to have another outbreak. If we go back and just have another outbreak again, are we prepared for it? to the capacity from ventilators to PPE to protective equipment. It's a very important thing that I think we need to have in place. And I think we're going to have to be able to track and find either a database of information where we know if people have been tested and where they are, but only so much as it's used to be, just like we know if you had a measles test, but not used punitively, but only as a way to know if we, where we can stand up, reopen certain businesses. But I'm not sure that has to be part of the first phase, but I think that's something we have to think about longer term. And then I think, the other piece here is our supply chain. We have to make sure that we have, we start, and this is again a little longer term, but I think you can't start too soon. We have to immediately start working on pieces of supply chain that have to be addressed. So for instance, we should place orders now for the needles and the syringes to give out the vaccines. We're going to have to give out 300 million of these. Well, we don't stockpile that kind of quantity, and it takes about 10 months to a year to make enough. So we better place the order now so that we're ready when we do have the vaccine. So I think there's some immediate steps we need to take there. Last point, I think when we do reopen, it may be more by sector, it may be more regionally, and because certain areas are going to have certain numbers more than others. But some of the guidance that the administration is starting to put out about if you go back to work as an essential employee, being checking temperature constantly and having requirements on that, and having to wear masks in certain locations and in certain instances is going to be essential. And until we figure this out, we're just going to have to take steps that we're not used to, but will allow us to reopen our schools, reopen our businesses. And I think those are the kind of benchmarks we should put out there.
Josh, this is Mike again. You just mentioned Becton Dickinson there in your district. We know them well here at BakerHostetler, and they're an amazing company, and they've been really stepping up in so many ways. You also, I know, recently signed a letter led by Elliot Engel and Fred Upton to protect Medicare beneficiaries and in support of home infusion practices, which is, I know, a really, really important issue. We had a question from one of our listeners. They're interested to learn, what are you hearing from providers in the district and how they're adjusting to the stay on elective procedures? Obviously, it's a real challenge for folks who are, wanting to prevent other illnesses, perhaps catch long-term illnesses early. How are you hearing back from? I know you mentioned some of the hospitals in your district. I appreciated the mention of Valley Hospital in Ridgewood, where I was born. But what are you hearing from some of the companies and the healthcare providers on the stay on elective procedures?
No, that's it's why, frankly, we need more support for our hospitals right now. One of the reasons we need more support from our hospitals, not just for all they're laying out for equipment and the reimbursements, they might not be getting back right now what it's costing them. But as you know, a lot of them rely on those elective procedures for their revenue, and that's been cut off in a lot of cases. There's also other things that can only hold off for so long. It may not have a time pressure and can hold off a month, but not 3 or 4 months. So it's put a lot of pressure on the hospitals. I know that's why we federally in the CARES Act, fought so hard to get resources for our hospitals, and frankly, why we're pushing more in this pack. And this is not there's a CARES 4 that's coming. I'll call it a CARES 2 that's coming, and where we are right now and what we're pushing for more extension on the PPP program, and money about, and this is kind of where you saw this fail on the Senate floor this morning for unanimous consent, is, there's a little bit of a disagreement between, many of us think we got to put more money for the states and more money for our hospitals in there, not just PPP, because our hospitals are really hurting and they're spending a lot of money. We need to keep them up. And also, of course, all the personnel overtime and other, there's just a huge demand on the resources of our hospitals right now. And we need to make sure we've done some things to help advance some dollars for them. But we know that they're going to face very difficult economic times, and already are in terms of their budgets.
I want to. This is Mike again. I just want to follow up on that. You mentioned the motion this morning that failed in the Senate to have unanimous consent. Leader McConnell's effort to try to infuse more money into the program. It's kind of a newsy day. You have the Fed's announcement on the $2.3 trillion on the credit and lending facilities, and you have these proposals bouncing back and forth. I know Speaker Pelosi and Leader Schumer released some criteria that they're looking for additional funding, and you are involved in so many bipartisan things, right? You're one of these folks who's always trying to forge a bipartisan agreement and compromise. Where do you see this playing out right now, particularly on the next bill? Are you optimistic that something can be done more quickly, or is this going to have to wait until like next week?
Well, I'm hoping, some of the things I've heard of is that there just might be a couple salvos back and forth like we did when we were working on the first CARES package. And frankly, when we worked on our first two emergency responses, which ended up being bipartisan, but there was a day of negotiating that goes on. You got to have a couple failed, false starts before you get to the finish line. And, I believe we all recognize that we've got to get these resources out the door quickly. We've got a supply demand issue on the PPP program, and that we've got to address. But we also have, as you just asked me about, we got challenges with our hospitals that are also coming to us, and same with our states, especially those who are in the eye of the storm. And we'll have other states that are going to be in the eye of the storm, and hopefully it's going to be a lot less of a problem than New York and New Jersey faced by being early, and before we were all quarantining. But I'm hopeful that we get to an agreement fast. Let's just be realistic. We've been doing a lot in a bipartisan way for 6 weeks. Even we have little stunts that go on back and forth, and on that last package where that unanimous consent issue from Massey, and so we're gonna have, it's not going to always be perfect, smooth sailing, but I believe we'll get there. And remember, we're using a lot of muscles here that we haven't used in a long time, and that leadership hasn't either. There hasn't been a ton of bipartisan cooperation across the board for these last years, as you know well, right? So a lot of these muscles have atrophied, and so we're rebuilding them. And those of us who are used to working together, the Problem Solvers Caucus, we're just used to doing this every day. So for us, it's more second nature. We have a trusting relationship, and just keep in mind that it's hard to build some of those relationships in the middle of the fire, and that's what we're asking folks to do on both sides. And so it means that there's going to be some bumps.
Josh, this is Heath. We obviously got a long road ahead of us. And how do you see the path going forward to get the economy boosted back? After, we're starting to see some areas in the country that the curve is being flattened. I guess two parts to it is one, when do you think this is going to be we go back to life as somewhat normal, and the economy kind of kickstarts again? Our restaurants starting to open up, the hotels are back operating again. Has there been any talk about, what you guys are actually hearing from some of the experts that have really kind of dove into the numbers and what that looks like in the future? I mean, are we looking summertime, midsummer, fall? When do we think we'll kind of get back on the right path again?
Well, I think a lot of people are optimistic, and depending upon where you are in the country, that's why I think it's very regional driven. That late May, early June is not, or mid-May, depending upon where you are, and early June is not is a potentially realistic approach for reopening and phases. And I think the phases piece is key. Unfortunately, I believe until we get to a vaccine, and maybe I could just be wrong about this, but the experts I'm talking to are telling me that we have to be realistic about a few things. We're going to reopen, and people are not going to rush to restaurants in the same way, and they're going to avoid concerts, and they may avoid certain public transportation, and might not go on those trips. And so you might have certain sectors that have continued to do well, like tech, and other sectors that just don't, right? And or they'll be more hit by this than others. And I think that's probably reality here, right? Your restaurants and your leisure and travel are going to take a lot harder hit than maybe your, the home products and grocers that are able to obviously still need to function. And since if people are eating out less, they're going to be eating home more and spend more on the grocers than they did before. And so those sectors might do okay, whereas other sectors won't, or it's going to take longer. I think either way, you're facing, if we're not in a recession, we're going to be in a recession just because of the reality of those sectors and the hit on the economy, and all these people who don't have disposable income because they're out of work. Even if we help them, there's still a lot of people are out of work, and that's going to continue to be a huge challenge. And so even when we get stood back up, people are going to be behind, and they have lost a couple months of income or extra income. They're just skating by, or they don't have their jobs, or it takes a while to get back into their jobs. So I just think that's kind of reality.
Josh, this is Mike again. You and Tom Reed, your co-chair in the Problem Solvers Caucus, you had an op-ed in the USA Today several days ago. What's been the response? You had a number of different items that you were talking about. What's been your response, and has your sense been that's jump-started any conversations or built momentum for any of the provisions that you talked about in there?
Yeah, very positive response in the sense that I heard from Democrats and Republicans, and this was again reflective of our Problem Solver Caucus and our views, or the 50 of us, that the people want to see a roadmap and a plan to reopen. And I think, we put a lot of issues on the table that both in the short term and long term need to be addressed. And if we don't have something to shoot for, it's very hard, right? So we can't just say we'll get there without saying what we're aiming for. And I think we need a pretty clear map of what we're aiming for and what we're going to have to do legislatively or otherwise to get there. And frankly, that's exactly what the next phase the caucus is working on. We had a big plan of an economic revival plan in our first package the first package that the caucus put out. What we're working on right now is that second revival plan, which is really what are these benchmarks we need to hit and what legislative steps we're going to have to take or other steps that have to be taken as a country to get there. And that's what I mean when I said including the universal, having more of a universal approach to testing and rapid testing and serological testing, and right, so those certain items. So we're trying to. This is tough because, as because your clients are having the same issue. A lot of us are just building this plane while it's flying and trying to figure it out, and which means things are going to change constantly, and it's an external force happening to us. So, what we're, the goal is to just accelerate this conversation so that we're not all looking at each other week after week saying, "Are we ready yet?" Well, what makes us ready, and how do we know when we're ready?
Yeah, it's great. It's a great point. And you mentioned when you mentioned our what we're hearing from our clients, it was interesting. One of these key flashpoints on the CARES Act that we've had a number of folks in our audience who have been asking about either privately or on our webinars is this this affiliate rule. You may be familiar with this because of your work on the Financial Services Committee, but it's where it may exclude some private equity and some venture-backed companies from the PPP, from the Paycheck Protection Program. How do you strike a balance? I don't know if this was envisioned or anticipated as the bill was being written. Obviously, it was done so quickly. It's hard to be meticulous. It's hard to anticipate every unintended or intended consequence when legislation has to be enacted so quickly. But how do you strike the balance between ensuring that the CARES funding flows to its intended purpose of keeping workers employed and paid if there are some exclusions or issues like this on these, in particular on this affiliate rule?
No, it's a great question. I think the regulations that make sense in normal times need to be examined for their effectiveness during a crisis, and whether they're serving their intended purpose or inhibiting relief that we need to get out. I led a bipartisan letter to Secretary Mnuchin and the SBA requesting the affiliate rule be waived for receiving funds authorized by the CARES Act. the majority of young businesses have fewer than 500 employees and are operating on a month-to-month basis as they grow in their market. This gives them greater risk to continued operation and the ability to keep employees. And these businesses are vital to keeping our jobs, keeping our workers employed, and key to success in the economic recovery. So I think that's, I frankly think we need to waive the affiliate rule for this particular relief package.
Josh, looking at the supply chain from the hospital standpoint, both, from the pharmaceutical standpoint and the hospitals and doctors, I mean, has there been any talks, to how to help that out, the supply chain, any problems or issues? I mean, because, if it continues to spread throughout the United States, we're going to have some problems. And obviously some really great companies have stepped forward and started making some of the ventilators and masks and other things. But there's probably things that we're not hearing about from a supply chain that may be of critical need. What are you guys? By
the way, that's a great question and a really important one. And to we've had a lot of companies step up or be asked to step up and produce to help out in the crisis. There's a group of us and introduced legislation. It's bipartisan. We did so last week, creating a 9/11 commission for afterwards on the response to the pandemic. And the bill has a significant supply chain component. It's Made in America Emergency Preparedness Act is what it's called, because I think we need to think through longer term what kind of supply chain issues we need to address, so that if this were to happen again, we at least can take care of our own shop versus having to rely internationally in a time of crisis. So whether that's medical supplies or certain pharmaceuticals or the ventilators or other equipment, at least to beef up our stockpile and to be able to turn it on more quickly if we need it. And there's a lot of these items from masks to ventilators to gloves to all these other things. We don't have the capacity that we need. It's going to be, I think this needs to be a nuanced approach, because recognizing we live in a global trading society, you just can't. There's just certain things that have shifted around. That said, I think we need to re-examine what we actually have to have in place here, and at least be able to turn on at a greater strength if we need it. We've exposed a weakness here, and we've got to make sure that we fill it in, God forbid we have another crisis like this.
Josh, this is Mike again. Back in March last month, you introduced legislation to update the 2017 pandemic influenza plan and the national planning frameworks to add to the requirement that the preparedness and recovery planning include a pre-crisis sort of menu of options focused on economic and monetary and consumer financial issues. Can you tell us a little bit more about your bill, and can these changes be made without legislation? I'm just wondering, what could be done to update that? Clearly, we need to update it. We've experienced and learned a lot, unfortunately, these last several weeks. Can you tell us a little bit more about that?
Yeah, I mean, and it kind of builds on what I was talking about, which is this is part of the same thinking about creating a commission on preparedness for national emergencies. Many of us are deeply concerned that whether it's another crisis like this one or frankly something that hopefully next time hopefully we will never face something like this again. But we have to look at that supply chain, and we have to be prepared. We have to be prepared domestically from that perspective, and I just don't feel like we are. So I bet we have to update this plan and make sure that we actually execute it. We've all heard, and again, I think it's unhelpful right now to be in the blame game. We should be looking forward, not backward. But I mean, there's a lot of things we're going to have to examine afterwards to understand where the gaps are and where, what aspects of this we're not following or we should be following. And and I think there's aspects that we're going to have to ensure, there are requirements we're going to have to put in place that are not voluntary, but actually obligated, that we're obligated to as a country to do, and that we do as regular order. Our stockpiles we have to really look at our stockpiles. And now the problem with stockpiles is these things have shelf life, so you can put certain pharmaceuticals in there, but they may only last for 3 to 5 years. So then you have to replace them and make sure you do it. Are we checking all of our ventilators regularly to make sure we have what we need on that front? How many do we need, and are they working? So there's a lot of questions that we've got to line up and get answers to, and it's part of why we want this 9/11 style commission afterwards. Not again bipartisan and really to look at this not from at all a political perspective, a partisan political perspective, but from what's the country need to have in place.
Yeah, following up on that, I'm sure Peter Navarro at the White House, who's been sort of beating the drum on this issue, this supply chain issue, and manufacturing in the U.S. and has ideas, certainly which would, I think, disrupt a lot of the current supply chain that we have in this country, whether they're on medical or pharmaceutical supplies or component parts or a lot of other things in different industries. Have you or other folks, your colleagues in the Congress, had many conversations with him in these last few weeks? I know he's, continues to. You hear him on the briefings sometimes talking about how important it is for us to move manufacturing back to the U.S. But a lot of folks in the business community obviously have concerns about that from a disruption standpoint, from a cost standpoint, and other sorts of disruption issues. Have you heard much or had much communication with Peter Navarro or some of those other folks who may share his view in the administration?
Well, we just got off a call with Joe Grogan a few minutes ago, and we did a call yesterday with the Vice President. The caucus, the Problem Solvers Caucus, has a good relationship with his office, and in fact, when Dr. Birx was her first day on the job and she'd just flown in from I think Africa, we met with a bipartisan group of us of the Problem Solvers, met with her and the Vice President in the Situation Room. This was right before we passed that first package, the $8 billion first package, which, if you remember, seems like eons ago, but relatively wasn't that long ago. So we've had a lot of conversations. This is a real, and that's why I think we're going to have to do a deep analysis on what do we have to have here, what's doable here. What's practical, and it might just be that it's going to be a cost that we're going to have to inherit as a country to have certain things in place. But obviously we're a private sector driven, market driven economy. And so you got to decide where the government for emergency purposes needs to weigh in and what we need to have. And frankly, do we just have to purchase certain things and place orders for it and work as a public-private partnership, or is this something that the public sector has to do? Those are the kind of questions I think we're going to have to address in when we get past this immediate storm. And they're really good questions, and I don't necessarily have the answer because there's no one size fits all for everything. But I think it's going to be sector by sector that we have to look at this and decide what it is we need to have in place. But the fact that we couldn't get PPE, to me is, and that it's taken so long to get it out, and our first responders and many of our frontline healthcare workers just don't have an adequate supply right now, to me is unacceptable. And it's unacceptable how long it's taken to get there, in my opinion.
So, kind of back to the first responders and health and doctors' offices and primary care physicians, do you think the expanse of the telehealth, telemedicine, do you think that's going to become more of a permanent way moving forward, as we go through this process? More acceptable? I mean, other than, the way we typically go to a primary care.
Sorry.
You've got the telemarketing, the telehealth, medicine. Is that going to become more of a permanent fixture for us as moving forward?
I think a lot of the extreme steps and measures we're taking now may stick with us after this is over, and more expansive telemedicine and actually reimbursed telemedicine, which many of us believe is necessary, maybe one of those things. This could be a lifesaver for and it is from seniors already, or people with disabilities and others who are homebound, or frankly, it will allow for more healthcare space and more growth in certain sectors and be able to respond respond more quickly. I think that's a good thing. I also believe that, frankly, and this might, it depends how you look at it, what sector what you're in. I think the reality might be that we use a lot more Zoom to run meetings than we did before, and a lot more teleconferencing than we did before. And people might be, say, I don't need to hop on a plane for that. That was fine to be able to do. I'm used to now doing this, and this is not an odd thing to do, right? And I frankly,
Absolutely.
with doing a Zoom meeting, right? I think we're all, frankly, adjusting to that now. So, I think there might be more of that than that might be one of the unintended results of this, which, by the way, has an impact on the airlines and hotel business and
a lot of others. Josh, it's Mike. I want to return to the life sciences industry in New Jersey. Of course, so important. We in New Jersey like to say we're the medicine chest of the world. There are other areas of the country like to claim that as well. That's fine. But we know we have so many researchers and scientists and great companies and individual workers who work so hard on finding those cures and developing new technologies and new medicines and new devices. Wasn't too long ago that we were hearing.
By the way, I'm back.
You're back. You're back.
And by the way, hence the side of the technology negative. There you go.
No problem. I'll just restate the question. I was saying it's those of us in New Jersey who know how what a great life sciences industry we have. So many of our your constituents, my old constituents, folks in the life sciences world, researchers and scientists and others who work working so hard to develop those new technologies and devices and cures and treatments and for so many different conditions and diseases. It wasn't too long ago that we had pharma CEOs were just called crooks and criticized, and now it seems everyone's looking to this industry to help develop a vaccine and help develop a treatment, help develop a cure. You are one of the top advocates in Congress certainly for New Jersey's life sciences community. Do you think this may represent an inflection point in terms of the reputation of the industry in some people's eyes? Obviously, people like you and I,
man, I hope so.
We have a great appreciation for these folks who do this important work. But what do you think about others who have typically been more critical of the industry?
I think that's a phenomenal question because let's be honest that the certain industries just become punching bags, because you'll have one bad actor or a couple bad actors, even though 99% of the actors are good actors doing great work every single day. And you think about all the life-saving drugs that have come out of New Jersey and the R&D that's invested every single year in our great state and in my district, but it's just remarkable. And now, of course, you get on the phone, everyone thinks, as you say, they're recognizing that they're lifesavers and thankful for the work they're doing. And we're going to be, obviously racing toward a vaccine, but in the meantime, a lot of palliative care, which our life science companies will develop. So I'm really hoping that in the end of this, there'll be a greater appreciation for what we do, and obviously a renaissance and resurgence in New Jersey, especially if we have to make more of this stuff at home. That could be helpful for New Jersey and for domestic R&D and production. I think we should, like we always do, we go through these ups and downs of different sectors and different people to blame for different things because of a couple bad actors. But I really, my hat's off to the life sciences space in New Jersey, whether in my district, I've got so many of them. I spoke earlier this week to D-N.J. I was on the phone with the CEO of BD yesterday again, and Stryker. There's so many excellent producers who are involved in New Jersey, Merck and Pfizer and others who play Sanofi, who play such a key role in developing so many of the drugs that we're relying on right now. and I'm just hoping they can keep it up. And on the other end of this, to your point, on the other side of this, that we continue to appreciate what they do.
It's a great point, and I have to certainly acknowledge my friend Heath Shuler here on the phone from North Carolina. They also have a fantastic life sciences industry in North Carolina, but those of us from New Jersey were a little.
They do, and they stole
our neighborhood.
They stole it. They stole some of our people.
We're trying to do all we can to help out everyone in the world in the life sciences field for sure. So, but I give it to you, New Jersey. You guys do kind of lead the way, so that's for sure.
Josh, something Heath and I have both been talking about. Maybe we can close with this. Any conversations about remote voting or remote work by Congress these days? I mean, I know it's in the news. And
man, I'm so glad you asked that. I'm really glad you asked that, especially because it looks like while we're on this call, there was some agreement from the speaker that we're probably going to have trouble getting back April 20th, which was the week of April 20th, which was the date we were shooting for. We've had the Problem Solvers Caucus actually wrote a letter to our leadership, a bipartisan letter. Again, there's 25 Democrats, 25 Republicans, asking for and laying out a series of options for remote participation, whether that's hearings for oversight purposes, especially in our committees and developing the next round of legislation here, but also voting. And there's plenty of secure ways to do it, and we need to set it up. You can't just have a few people. Our Constitution, Article 1, doesn't allow for a few people to control the legislature. And right now we're dependent on unanimous consent for everything, and have a real inability to propose certain amendments and amend, beyond offering them through our committee chairs certain feedback. And I think it's very important that we're able to do that, especially, you look at my district, as I mentioned, given what we're facing here, there's certain things that are essential that I want to make sure get included, and how you do that by building coalitions, and as we always do, and getting things through or preventing things that would undermine the economy or undermine health, and if that's your opinion, in our country. So we're pushing for that, and I'm very hopeful that in very short order we just haven't seen direction on this yet, but again, we're pushing very hard, and publicly there's stories about this, picked up in the Hill and New York Times around what we're doing, and other publications picked up on it, and I'm hoping that becomes more of a conversation in short order, that we get some results. A lot of members are feeling that we should have a way, means to, England's doing it, came out of the way, Australia did, Japan did, other countries, Spain, other countries have figured out how to do this. There's absolutely no reason why we can't, and it's completely consistent with Article 1 of the Constitution, which is to fulfill our responsibilities to represent our constituents. I'm sure you would have felt the same way if you were, if you were in the Congress right now.
There'll be less arm twisting.
Yeah, that's right. Less physical arm twisting. Well,
that's right.
It's so interesting, and it's sometimes crises like these that really spur conversations about changes that might need to be made. I mean, it was my first year in Congress, I remember, was the attacks of 9/11, of course, which impacted our whole country and the world, but our area in New Jersey certainly so personally. And there were a number of conversations then, I remember, about how we would convene and how we would continue the work of the Congress. And this new crisis, may be spurring some of those conversations as well. So I have to say, Josh, we are so delighted that you've been able to join us today. You are a great guest.
Thanks so much.
And you are working so hard for the country, and certainly for your communities and municipalities and across your district in New Jersey. And we just want to thank you for your time today. We are certainly keeping you and your constituents in our thoughts, our prayers, and as you continue this work, and certainly wishing everybody in your district a happy Passover, a happy Easter, and peace and health and safety during these tough days.
Thank you, and so much for doing this and for bringing people together. And for those who celebrate Passover, happy Passover and happy Easter. And Ramadan's coming up, and I just want to wish everyone health and safety. And we're thinking about everyone. And please, if you need anything, don't hesitate to call, and you can get the information to me or questions to me if you've got ideas. We love ideas, and we certainly don't own them here. What you're seeing every day is really helpful for us to get us that feedback. So where there's problems in the certain bills, fixes that need to be made, technical corrections that need to be made, please get them to me, and I'd be very grateful to have them, and I'll be responsive. And I really just appreciate everyone being patient and hanging there. And thanks for doing this.
Thank you.
Bye.
So Heath, we have more to come next week.
Yeah, that's right, Mike. Next week we have Senator Tom Tillis from my state here in North Carolina, and then later in the week we have the Maryland Senator Chris Van Hollen, who both of us actually served with in the House.
We did, yeah. He served in the House with us. Senator Tillis is going to be with us on, as I mentioned, on Tuesday at 12 noon Eastern Time. And as you say, our former House colleague, now Senator Chris Van Hollen from the state of Maryland, will be with us on Thursday, April 16th at 2:30 p.m. Eastern. So it's another really strong bipartisan pair of legislators who are going to join our series. So we certainly encourage those in our audience to register for those webinars. Submit your questions at bakerlaw.com. And until then, we are wishing everybody a very happy Passover if you are observing Passover, a very happy Easter if you're observing Easter, and for all those celebrating this week. And my friend Heath, very happy Easter to your family from our family, and even in the midst of all of these difficulties and challenging days, we're hoping everybody will enjoy the blessings of this season.
Absolutely, Mike. Happy Easter to you and your family. All the best.
All right. Thank you, my friend. And good afternoon from Washington, D.C. We'll look forward to speaking with you all next week.